How long does it take to get off psychiatric medications? The short answer is as long as it takes. My name is Dr. Ruth Dutton. I'm a board certified adult psychiatrist, and this is a topic that's really not addressed enough either in our medical training or in the office between doctor and patient. But it's so important. So let's get into it. So traditionally, if you talk to your prescriber about going off of your psychiatric medications, most are going to take a linear taper approach, which means that they're going to go down by a set amount each reduction. So for example, if you're on sertraline, otherwise known as Zoloft, and you're on 200 milligrams, which is the maximum dosage, you may go down by 25 or 50 milligrams with each reduction. So down to 150, 100, 50, maybe 25 milligrams before stopping. But as we spent more and more years prescribing these medications, we've learned a few important things. First, we've learned that when people take these medications for years and years, it can have dramatic changes on their brain chemistry. And so, although the studies that we have show that most discontinuation symptoms from SSRIs or other antidepressants are mild and self-limited, these are based off of study samples that are on these medications for only 8 to 12 weeks. But I'm seeing patients who've been on these medications for 8 to 12 years, if not more. So when a patient's been on these medications for that long, it can cause a lot of difficulty with coming off of the medications. And if you come off of them too quickly, it can cause severe adverse effects, things like protracted withdrawal, which I've talked about in other videos on my channel. We've also learned that rather than doing a linear taper schedule, it's really better to do a hyperbolic taper schedule, which means that rather than going down by a set dosage each time, you should go down by a set percentage of the dose each time. And the reason behind this has to do with receptor occupancy of the drug. When you have a dose change at lower doses, that dose change has a much greater relative change in receptor occupancy of the drugs than when you have that same dose change at a higher dose of the medication. So let's give an example. So for sertraline, if you increase the dose from 25 to 50 milligrams, that's a much larger dose increase in terms of receptor occupancy than from 175 to 200 milligrams. So the same can be said when it comes to dose reduction, that it gets much harder to come off of the medication to reduce the dose at those lower dosages than at the higher dose. So that's why we use that hyperbolic tapering schedule. We can tolerate larger reductions in the dose at the higher dosages, but we have to decrease that as we get to the lower doses. So we usually recommend starting around a 10% dose reduction schedule. So if you're on sertraline 200 milligrams, that would mean decreasing by 20 milligrams to start. So that would take you down to 180 and then by 18 milligrams. Now, of course, we don't have tablets in these dosages. So it can be helpful to switch to a liquid formulation to help you to have more exact dosages, or there are compounding pharmacies that can actually change the solutions and the concentrations of the medication so that you can do very small, precise changes in dosages. Now, these aren't necessarily widely available and they aren't always covered by insurance. So these can certainly be barriers. The patients that I work with cannot afford this type of resource, so if at all possible, I will try to switch them to a liquid formulation. Now, some individuals will be able to go faster than that 10% dose reduction at a time, and some will need to slow it down depending on certain susceptibilities, like if they've had a brain-related injury, if they have other neurologic conditions, their age, if they've had a history of difficulty coming off of other psychiatric or neurologic medications. So if you're considering coming off of one of your psychiatric medications, please look into this and make sure to talk with your prescriber about it before you start the dosage reduction process, because it's important to mitigate the risk of potentially adverse effects like we've talked about. If you have any questions about this, feel free to put in the comments below. Wishing you all good mental health today, and I hope to see you in the next one.